Hello everyone. Today, we're diving into the world of a medication called Sitagliptin, commonly known by its brand name, Januvia. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Sitagliptin, often recognized by its brand name Januvia, is an oral tablet that falls under the category of DPP-4 inhibitors. Its primary function is to regulate blood sugar levels by increasing the levels of incretin hormones, which help control blood glucose by increasing insulin release, especially after meals, and decreasing the amount of glucose produced by the liver. Initially approved by the FDA in 2006, it's primarily prescribed for type 2 diabetes in conjunction with diet and exercise. Sitagliptin is also used to improve blood sugar control in adults with type 2 diabetes. It can be used as monotherapy or in combination with other medications, such as metformin or a sulfonylurea, to help manage blood sugar levels more effectively. Warnings: Sitagliptin comes with its set of precautions. It's not intended for those with type 1 diabetes or for the treatment of diabetic ketoacidosis. Additionally, it should be used with caution in patients with a history of pancreatitis or those who have risk factors for pancreatitis, as there have been reports of acute pancreatitis in patients taking sitagliptin. It's also important to monitor renal function periodically, as dosage adjustments may be necessary for those with moderate to severe renal impairment. Before taking this medicine. Before starting sitagliptin, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the pancreas and kidneys, those with pancreatitis or kidney diseases or conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood sugar levels is advised for those with diabetes or at risk of diabetes. You should not take sitagliptin if you have a history of serious hypersensitivity reactions to the drug, including anaphylaxis or angioedema. Before starting the medication, inform your doctor if you have ever had heart problems, kidney problems, pancreatitis, gallstones, high triglycerides, or if you drink alcohol very often. It's also essential to let your healthcare provider know if you are scheduled for surgery or certain X-ray procedures with injection of dye, as this might affect your blood sugar levels. Side effects: all medications can have side effects, and sitagliptin is no exception. Some individuals might experience upper respiratory tract infections, headaches, or diarrhea. There's also a potential for joint pain. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of developing pancreatitis, a serious condition where the pancreas becomes inflamed. Symptoms can include severe abdominal pain, nausea, and vomiting. If you experience any of these symptoms, it's crucial to get medical help right away. Other potential side effects include allergic reactions, which can manifest as rash, hives, or swelling of the face, lips, tongue, or throat, and hypoglycemia, especially when used in combination with other diabetes medications like insulin or sulfonylureas. Interactions: sitagliptin might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Specifically, it's essential to inform your healthcare provider if you're taking medications that can affect your kidney function or other diabetes medications. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking sitagliptin. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of sitagliptin for most adults with type 2 diabetes is 100 mg once daily, with or without food. For patients with moderate renal impairment, the dose should be reduced to 50 mg once daily, and for those with severe renal impairment or end-stage renal disease requiring dialysis, the dose should be reduced to 25 mg once daily. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on sitagliptin, it's advisable to stay hydrated and maintain a balanced diet to help manage your blood sugar levels. Given the potential for dizziness or joint pain, it's wise to be cautious with physical activities. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects and affect blood sugar control. FAQ: many wonder about the age restrictions for sitagliptin. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of sitagliptin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.